Every single night, you lie down in your bed, close your eyes, and drift off to sleep in a position that feels comfortable. A position you have probably been sleeping in for years, maybe decades. It is automatic. It is habitual. You do not even think about it. But what if I told you that the position you sleep in could be the reason you suffer a stroke? What if I told you that there is one common sleeping position that is silently, night after night, increasing the pressure inside your brain, restricting blood flow through critical arteries, and setting the stage for a devastating, life-altering, or even fatal cerebrovascular event? And that 97% of people have absolutely no idea this is happening? That is exactly what I am going to tell you today, because this is not speculation. This is not fear-mongering. This is based on vascular anatomy, fluid dynamics, and emerging research that every single person, especially every person over the age of 50, needs to understand. The sleeping position you choose tonight could determine whether you wake up healthy tomorrow morning or wake up unable to move one side of your body, unable to speak, unable to recognize your own family. The dangerous sleeping position I am talking about is sleeping flat on your back with no head elevation, especially if you have any degree of existing cardiovascular disease, high blood pressure, atrial fibrillation, carotid artery disease, or if you are over the age of 60. Now let me be very specific about why this position is dangerous, because the mechanisms are multiple and they compound each other in ways that make the total risk far greater than any single factor alone. Mechanism number 1. Increased intracranial pressure. When you lie completely flat on your back, the gravitational dynamics of blood flow in your body change dramatically compared to when you are upright or even partially reclined. When you are standing or sitting during the day, gravity helps pull blood downward from your brain back toward your heart. This assists in venous drainage, the process by which deoxygenated blood exits your brain through the jugular veins and returns to your heart for reoxygenation. Gravity is your brain's ally in maintaining healthy intracranial pressure during waking hours. But when you lie flat, gravity is no longer assisting venous drainage from your brain. In fact, when you are completely horizontal, the pressure differential that normally helps blood drain out of your skull is essentially eliminated. Blood pools in the venous sinuses of your brain. The jugular veins, which are your brain's primary drainage channels, experience reduced flow, and the result is a measurable increase in intracranial pressure. For a young, healthy person with completely normal blood vessels and no cardiovascular risk factors, this modest increase in intracranial pressure during flat sleeping is generally well tolerated. The brain's autoregulatory mechanisms compensate, adjusting blood vessel diameter to maintain stable blood flow and pressure within safe limits. But for someone over 60, for someone with high blood pressure, for someone with stiffened arteries that have lost their ability to dynamically adjust their diameter, for someone with small vessel disease in the brain, this nightly increase in intracranial pressure is not benign. It places additional stress on already vulnerable blood vessels. It increases the pressure against the walls of weakened arteries and arterioles inside the brain. And over time, this repetitive nightly pressure increase can contribute to the rupture of a weakened blood vessel, causing a hemorrhagic stroke, the type of stroke caused by bleeding inside the brain, which carries a mortality rate of roughly 40% and leaves many survivors with severe, permanent disability. Mechanism number 2, compression and reduced flow through the vertebral and carotid arteries. Your brain receives its blood supply through 4 major arteries. 2 carotid arteries run up the front and sides of your neck. 2 vertebral arteries run up through channels in your cervical spine, the bones of your neck. Together, these 4 arteries merge at the base of your brain to form the Circle of Willis, a circular arrangement of blood vessels that distributes blood throughout your entire brain. When you sleep flat on your back, your head position relative to your neck and spine can significantly affect blood flow through these critical arteries, particularly the vertebral arteries. If your pillow is too high, too low, too flat, or if you tend to turn your head to one side while sleeping on your back, you can partially compress or kink these arteries. The vertebral arteries are particularly vulnerable because they pass through bony canals in the vertebrae of your neck. Any abnormal angulation, any rotation, any extension or flexion of the neck beyond its neutral position can reduce the diameter of these arteries and restrict blood flow to the posterior portion of your brain, which controls vital functions including vision, balance, coordination, and consciousness. In someone with existing atherosclerotic plaque in their vertebral or carotid arteries, even a modest reduction in arterial diameter from positional compression can push an already narrowed artery past a critical threshold. Blood flow drops below what the brain tissue needs, And if the restricted flow persists long enough, or if a piece of plaque dislodges due to the mechanical stress of compression, the result is an ischemic stroke, the type of stroke caused by a blockage that cuts off blood supply to a portion of the brain. This mechanism is so well documented that there is actually a medical term for it. Bow-Hunter syndrome refers to stroke caused by compression of the vertebral artery during head rotation. While the extreme form of this syndrome is rare, lesser degrees of vertebral artery compression during sleep, occurring night after night for years, can cause transient ischemic attacks, which are mini-strokes that serve as warning signs and can contribute to chronic reduced blood flow to the brain that accelerates cognitive decline, vascular dementia, and increases the risk of a major stroke event. Mechanism number 3, obstructive sleep apnea and its devastating cardiovascular consequences. Sleeping flat on your back is the single worst position for obstructive sleep apnea, a condition that affects an estimated 20 to 30% of adults over 50, with many cases undiagnosed. When you sleep on your back, gravity pulls your tongue, your soft palate, and the tissues at the back of your throat backward and downward. These tissues can partially or completely obstruct your airway, blocking the flow of air into your lungs. When your airway gets blocked, your oxygen levels drop. Your brain detects the falling oxygen and triggers a stress response to wake you up enough to restore breathing. Your sympathetic nervous system fires. Cortisol and adrenaline flood your system. Your heart rate spikes. Your blood pressure surges. And this cycle can repeat dozens, sometimes hundreds of times per night in severe cases. Every single episode is a cardiovascular emergency that your body has to survive. The connection between obstructive sleep apnea and stroke is overwhelming and irrefutable. People with untreated sleep apnea have 2 to 4 times the risk of stroke compared to people without sleep apnea. The mechanisms are multiple. The repeated oxygen drops cause oxidative stress and inflammation in blood vessel walls, accelerating atherosclerosis. The blood pressure surges damage the endothelial lining of arteries. The sympathetic nervous system activation promotes blood clotting. The intermittent hypoxia, the repeated episodes of low oxygen, damages brain tissue directly, making it more vulnerable to injury from any subsequent interruption in blood flow. And the chronic elevation of blood pressure from untreated sleep apnea, including the loss of the protective nighttime blood pressure dip that I discussed in a previous video, dramatically increases the long-term risk of both hemorrhagic and ischemic stroke. And all of this is maximized by sleeping flat on your back. Studies using sleep monitoring equipment have consistently shown that back sleeping increases the frequency and severity of apnea events compared to side sleeping by substantial margins. In many patients, simply switching from back sleeping to side sleeping reduces their apnea events by 50% or more without any other intervention. Mechanism number 4, atrial fibrillation and blood clot formation. Atrial fibrillation, often called AFib, is the most common cardiac arrhythmia in the world, affecting millions of people, with prevalence increasing dramatically after age 60. In AFib, the upper chambers of the heart quiver chaotically instead of contracting in a coordinated manner. This chaotic rhythm allows blood to pool and stagnate in the atria, particularly in a small pouch called the left atrial appendage. And stagnant pooling blood is the perfect environment for clot formation. If a blood clot forms in the left atrium and then gets pumped out of the heart into the circulation, it can travel directly to the brain, lodge in a cerebral artery, and cause an embolic stroke. Atrial fibrillation is responsible for roughly 15 to 20% of all ischemic strokes, and AFib-related strokes tend to be larger, more severe, and more disabling than strokes from other causes. Here is where sleeping position comes in. Research has shown that lying flat on the back, particularly in combination with the autonomic nervous system changes that occur during sleep, can increase the likelihood of AFib episodes in susceptible individuals. The vagal tone changes during sleep, combined with the increased blood return to the heart when lying flat, the potential stimulation from acid reflux, which is worsened by the flat position, and the effects of sleep apnea, all create a perfect storm of triggers for AFib episodes during the night. And here is the compounding danger. Many people with AFib have episodes during sleep and are completely unaware of them. They wake up feeling slightly off, slightly fatigued, maybe with a mild headache or a sense of unease, but they have no idea that their heart was fibrillating for hours during the night, potentially forming clots that are now sitting in their left atrium, waiting to be launched into their cerebral circulation at any moment. Silent nocturnal AFib is one of the most insidious and underdiagnosed risk factors for stroke that exists in medicine today. So now the critical question: what sleeping position should you adopt to minimize your stroke risk? The answer, supported by the convergence of evidence across all four mechanisms I just described, is to sleep on your side with your head slightly elevated. Side sleeping, particularly on your left side, offers multiple cardiovascular and cerebrovascular advantages. It keeps your airway more open, dramatically reducing the frequency and severity of sleep apnea events. It improves venous drainage from the brain compared to flat back sleeping, reducing intracranial pressure. It avoids the positional compression of vertebral and carotid arteries that can occur with back sleeping combined with head rotation. And it may reduce the autonomic triggers for atrial fibrillation episodes during the night. Research on sleep position and brain health has also revealed a fascinating additional benefit of side sleeping. Studies using dynamic contrast MRI have shown that side sleeping enhances the function of the glymphatic system, which is the brain's waste clearance mechanism. During sleep, your brain's glymphatic system flushes out metabolic waste products, including amyloid beta protein, which is the toxic protein that accumulates in Alzheimer's disease. Side sleeping appears to make this waste clearance process significantly more efficient than back sleeping or stomach sleeping. So not only does side sleeping reduce your stroke risk, it may also help protect you against dementia by keeping your brain cleaner. The slight head elevation is equally important. Elevating your head by approximately 15 to 30 degrees, which can be achieved with a proper pillow or by placing a foam wedge under your upper body, promotes venous drainage from the brain, reduces intracranial pressure, minimizes acid reflux, and reduces the severity of any sleep apnea events that do occur. You do not need a dramatic elevation. You are not sleeping in a recliner, just a gentle incline that keeps your head above the level of your heart. Now let me give you a complete practical guide for optimizing your sleep position to protect your brain and your cardiovascular system. Step 1. Train yourself to sleep on your side if you do not already. This can take time if you are a lifelong back sleeper. Use a body pillow or a large regular pillow placed behind your back to prevent you from rolling onto your back during the night. Some people find success with the tennis ball technique, where you attach a tennis ball to the back of your sleep shirt so that lying on your back becomes uncomfortable and your body naturally rolls to the side. Step 2. Choose the right pillow for side sleeping. Your pillow needs to be thick enough to fill the gap between your shoulder and the side of your head, keeping your neck and spine in a neutral, aligned position. A pillow that is too thin causes your head to tilt downward, compressing the vertebral artery on the lower side and stretching the one on the upper side. A pillow that is too thick tilts your head upward, creating the opposite compression problem. The ideal pillow keeps your head level, your neck straight, and your spine aligned. Step 3. Consider a slight overall incline. If you experience any snoring, any symptoms of sleep apnea, any acid reflux, or if you have high blood pressure or a history of stroke or transient ischemic attacks, adding a gradual incline to your sleeping surface can provide significant additional protection. Bed risers under the head of your bed frame, a foam wedge pillow, or an adjustable bed base are all effective options. Aim for a 15 to 30 degree elevation of your upper body. Step 4. If you have atrial fibrillation, talk to your doctor about monitoring your heart rhythm during sleep. Wearable devices and smartwatches with AFib detection capabilities are becoming increasingly sophisticated and can alert you to nocturnal episodes that you might otherwise sleep through entirely. Early detection of nocturnal AFib allows for treatment interventions, including blood-thinning medication that dramatically reduce stroke risk. Step 5. Get evaluated for sleep apnea if you snore, if your partner has noticed you stop breathing during sleep, if you wake up with headaches, if you feel unrested despite adequate sleep duration, or if you have high blood pressure that is difficult to control with medication. Sleep apnea is massively underdiagnosed among older adults, and treating it is one of the single most impactful things you can do to reduce your stroke risk. Modern treatments include CPAP machines, oral appliances, and positional therapy, all of which are effective and well tolerated by most patients. Step 6. Avoid sleeping face down on your stomach. While stomach sleeping does keep your airway relatively open, it forces extreme rotation of your neck to one side in order to breathe, which maximally compresses the vertebral artery on the side you are turned away from. It also places strain on your cervical spine, can cause nerve compression, and is generally the worst position for neck and spinal health. If you currently sleep on your stomach, transitioning to side sleeping is one of the most important changes you can make for your vascular health. Let me also address a concern that I know many of you will have. What about people who move around during sleep? What about people who fall asleep on their side but wake up on their back? Is it realistic to control your sleep position all night long? The honest answer is that you cannot control your position every single second of the night. Your body will shift and move during sleep, and that is normal and healthy. The goal is not rigid positional control. The goal is to start the night in the optimal position, to make the optimal position the most comfortable and natural one, through proper pillow selection and environmental setup, and to create gentle physical barriers, like a body pillow behind your back, that make your body more likely to stay on its side or return to its side after shifting. Over time, with consistent practice and the right sleep setup, most people successfully train their bodies to spend the vast majority of the night in their preferred position. It typically takes 2 to 4 weeks of consistent effort before the new position feels natural. Be patient with yourself during the transition. The stakes could not be higher. Stroke is the 5th leading cause of death and the single leading cause of long-term disability in adults worldwide. Every year, millions of people suffer strokes that leave them permanently unable to walk, unable to talk, unable to feed themselves, unable to live independently. Many of these strokes happen during sleep or in the early morning hours immediately after waking, when the risk factors I have described, elevated intracranial pressure, compressed arteries, sleep apnea, induced oxygen drops, nocturnal atrial fibrillation, are at their peak. You spend a third of your life asleep. That is 20 to 30 years over the course of a lifetime. The position you choose for those decades of sleep is not a trivial decision. It is a decision that directly impacts the blood flow to your brain, the pressure inside your skull, the oxygen levels in your blood, the rhythm of your heart, and ultimately, whether your brain continues to function normally or suffers a catastrophic event that changes everything. And I want to leave you with one final thought that I hope stays with you long after this video ends. Every major medical advancement in stroke prevention over the past century, from blood pressure medication to blood thinners to surgical interventions, has required sophisticated technology, expensive drugs, or invasive procedures. But what I have shared with you today costs nothing. It requires no prescription. It involves no side effects. It demands no recovery time. Simply changing the position you sleep in and adding a slight elevation to your head can reduce multiple stroke risk factors simultaneously. It is perhaps the simplest, most accessible, most underutilized stroke prevention strategy in all of medicine. And yet, almost nobody talks about it. Almost nobody implements it. And millions of people continue to sleep in positions that put their brains at unnecessary risk every single night. You now have the knowledge to make that decision wisely. You understand the mechanisms, you understand the risks, you understand the protective strategies, and you have a clear, practical plan to implement tonight. Type in the comments what position you currently sleep in, back, side, or stomach. And type side sleep if you are going to make the change tonight. I want to see this information spreading to every person who needs it. Share this video with your parents, your grandparents, your partner, and everyone over 50 in your life. This is the kind of information that can prevent a stroke, that can prevent someone you love from losing their ability to speak, to move, to think clearly, to live independently. A simple change in sleeping position. That is all it takes. Subscribe and turn on notifications. I promise you the information I am sharing on this channel will continue to be the kind of truth that could save your life or the life of someone you love. I will see you in the next video. Sleep on your side tonight, elevate your head, and give your brain the protection it deserves every single night.